Welcome. We're so glad you can join us for a closer look at positive body image through body contouring. If you've lost a bunch of weight, congratulations. We know how difficult that can be and how hard you've worked. Sometimes that weight loss can lead to loose skin, causing health problems and struggles with your body image. The good news is one of Michigan's top plastic and reconstructive surgeons, Dr. Ihab Saab, has relocated from Metro Detroit to Hurley Medical Center to be more centrally located in the state, making it easier for patients to get care. Dr. Saab is double board certified in plastic and reconstructive surgery with a special interest in breast reconstruction, trauma reconstruction, hand surgery, lymphatic, and cosmetic surgery. He completed his residency at Henry Ford Hospital, where he is fellowship trained. Dr. Saab is so good at what he does, he's also teaching future surgeons. Today, Dr. Saab is going to explain your best options for tummy tucks, breast lifts, arm lifts, thigh lifts, and more. And what's great is he'll answer your questions live. If you have a question, text me at 248-935-2562. Text, don't call. You can also submit questions on Facebook or YouTube. Let's get to it. Thanks for joining us, Dr. Saab.
Thank you, Peggy. Good afternoon, everybody. Thank you for taking the time today for us to discuss options about body contouring after weight loss surgery. I think this is kind of a hot topic. There's a lot of misconceptions about it, and my kind of goal today is to go over what are the options, what are the surgeries involved, some of where are the incisions placed, and really open the platform for you guys to ask any questions you have. So, sure, you guys went through the hardship of losing weight. Some have lost tens of pounds, up to 100 pounds or more, and now we're left with the excess skin. And I hear that all the time from the patients. So I did all of this hard work. I'm having this excess skin. Who's going to take care of it for me? And as we see, it goes from deflated breasts that kind of lose their youthful look to excess skin around the upper arms to the lower stomach. And we always talk about the spanus or the apron of skin that hangs all the way down to the mons. We have the excess skin over the back and deflated buttock. Not to mention the thighs as well. And these come with a long list of challenges for the patients. So let's start with moisture, skin, and rash. A lot of our patients, because of this excess skin apron, ask them, it's very hard to maintain hygiene in these areas. You have the skin hanging over the mons. They might have difficulty getting into using restrooms, and they develop fungal irritation and skin breakdowns. Then you say, okay, I went through all of this to be healthy. I want to exercise. I want to go do everything I wanted to do. And a lot of times this excess skin and fat will also get in the way. I hear patients say, I can't get on a treadmill, I can't find the right athletic wear, or being able to do crunches, sit-ups, so on and so forth. And lastly, and I know the main goal to go through the surgery is to mainly, improve your blood pressure control, your diabetes, and prolong your life. But we always forget that we are stuck with the aftermath of the excess skin and fat, and this is always contribute to the sense that those patients feel like, I went through all of this. What can I do to improve things? And I had a reference for this photo. This is not my patient. This is from a YouTube, but doesn't show on the picture. So just saying. So what are your options? Options. We talk a lot about panniculectomy. Panniculectomy is in simple words, is we're going to get rid of the excess skin and fat that a person can pinch in the lower stomach. That excess skin and fat is what we usually remove. It does not involve any work on the ab muscles. These muscles could have splayed from the weight gain or from previous pregnancies. It literally just involves taking the skin and fat and relocating the belly button into its position. Usually those surgeries have to be affiliated with a medical problem. So usually we're talking about challenges with skin rash, fungal infection, fungal irritation. Sometimes the excess weight that is hanging causes a lot of back pain for some patients. So we really have to delineate that this is a medically indicated procedure to be able to offer that to patients. And patients sometimes confuse a paniculectomy with what we call an abdominoplasty, which is a medical term for a tummy tuck. And in those surgeries, in addition, it's a paniculectomy, but you add to it, at this stage, we're working on the muscles. We're bringing those muscles closer to the midline. We're improving the overall body contour. And sometimes we piggyback on those surgeries to address some of the flank excess skin and fat by doing some liposuction. So now we're going into the cosmetics of body contouring, not only the medically indicated. And again, we can combine an abdominoplasty or a tummy tuck with a buttock lift. And when we combine the two together, we call that a lower body lift. And sometimes you hear that term, it's 360 body lift or whole body contouring. And in those surgeries, in addition to the stomach excess skin and fat that we remove, we go to the back and we remove those excess skin and fat in the lower back, not the upper back, in the lower part of the back that is right around your buttock, and raise the buttock that have been deflated because of the weight loss. And again, those could be done in the same setting as one procedure, or sometimes patients get work done from the, on the stomach, on the breast, and at a later stage work on the back part in a different surgery. And the nice thing about when we talk about a body lift, we can also, in some patients, instead of getting rid of this excess skin and fat in the back, lower back, we can use it to augment the buttock, as in we use your own skin and fat to give you a nicer contour and the augmentation of the buttock without the need of using implants and without going down the options of, you guys hear about Brazilian butt lifts where they inject a huge amount of fat and fat grafting, and those surgeries have a slightly higher complication profile. In this setting, we wouldn't need to do that. We just use this excess skin and fat. Instead of throwing it away, we make it part of the buttock and enlarge the buttock at the same setting. So if we want to shift gear and talk about the inner thigh. So as we showed in the first picture, patients lose a lot of weight also in their thighs, and some patients lose more weight in their thighs than even in their stomach. And in that, we have two options to to try to tackle that. We either do a hidden incision that is way hidden up, like in the above picture, where we hide it in the groin, and that usually takes care of a lot of the skin, but it won't take care of the excess skin that goes all the way down to the thigh, especially if you have redundancy in the skin envelope all around the leg. For those patients that have a bit extra skin in the legs, we can do what we call the vertical incision. A vertical incision will go all the way down the inner thigh, and that will help us, again, get rid of more of this excess skin and fat. But the challenges are now this skin incision is more visible, right? If you're wearing shorts, they will show. And they come with a slightly, more complication rates, because now there is a slightly higher risk of swelling in the legs that could be prolonged injury to some of those channels that empty some of the fluid from the legs. So it comes with a slightly different complication profile. And in some patients, actually, we combine both incisions. They have both excess in the lower thigh and in the upper, and we do basically a T-looking like incision, basically combining the upper and the lower incision together. Arm lifts. Arm lifts, we also have options for those. And again, there's two ways of doing them, if we want to speak broadly. We either do a smaller hidden incision up in the armpit. And again, this is meant for those patients that don't have a lot of skin redundancy. We're talking about those patients that have just enough that if we pinch the skin around the armpit, they're happy and pleased with the outcome. And for those who have way more than that skin, I would say, we can do the standard arm lift. And again, the medical term for it sometimes patients ask is called brachioplasty. And those incisions, they either go over basically the inner part of the arm, so basically the part that's hidden when you bring your arm down to your chest, or you can do the incision to be on the back of the arm. And while those incisions are not noticeable when looking from the front, but people would see them over the back of the arm, especially if you're wearing a short sleeve. And those surgeries, again, are both options for some patients. Whether they're intending to hide an incision, they'll go with the mini option or the standard brachioplasty. And again, we tailor that to each patient alone. And lastly, for patients who have the excess skin in the upper back, we can always consider a back lift, where we really get rid of these skin folds in the upper part of the chest, around the back, and we hide them roughly around an incision that ends up being around the bra line. So this is an example of one of our patients where she had a weight loss surgery, and she was interested in undergoing basically a tummy tuck and at the same time get a breast lift. And in her, we were able to also, just similar to the buttock lift, we would use the excess skin and fat from her armpit or from basically the lateral breast. Sometimes patients refer to them as side boobs. And instead of getting rid of that, we dissect them down to their blood supply and we make them part of the breast. So not only do we lift the breast up, we also kind of augment this breast, make it larger without the use of any implants, using your own tissues, without any of the complications that come with implants. And this is kind of the neatness of these options. And at the same time, she had a tummy tuck surgery, and in her case, because she had so much excess skin around the flank, to give her a bit of the body contour or the hourglass look, we had to extend the incision into the midline as well. As you guys notice, this surgery does not address the flank areas. And if she decides down the line to finish the lower body lift by doing a buttock lift, and that would be the procedure that will take care of some of the flank areas and will lift the buttock area. And again, it would be an option for her if she's interested. If she wants to augment her buttock, we will use her own tissues instead of throwing them away by removing the skin and fat and make it part of her buttock. And that's kind of that would end my talk. And again, that's briefly all the options and the surgeries involved, and happy to answer any questions.
Yep, this is your chance to get your questions answered live. If you would like to ask Dr. Saab a question, post on Facebook or YouTube. You can also text me now at 248-935-2562. Dr. Saab, there's a couple people have talked about age and how long ago they had bariatric surgery. One person had it 17 years ago, one 20 years ago. Can you talk a little bit about, does it matter how long ago you've lost the weight? Does it matter how old you are?
Actually, Peggy, not at all. So the main thing we look for when we offer those cosmetic surgeries is how is the patient overall health, right? Weight loss surgeries come with a lot of sometimes nutrient deficiencies and vitamin deficiencies. So as long as they're optimized on their nutrition, their vitamin, they're overall healthy, and they're of appropriate age from a surgical point of view, are they a good candidate to go under the general anesthetic, there is really no restriction on them getting this surgery at any moment in time.
So if you lost like 100 pounds, like the next month, could you get a tummy tuck if you wanted to, or is there, do you wait a certain amount of time? Or?
That's a great question. So ideally, I want my patients to have a steady weight for at least 3 to 6 months. I sometimes even push it a bit, closer to the 6-month mark, because the last thing you want is again, to invest in a surgery, get rid of this excess skin and fat, or get a breast lift, and then lose more weight. So you would lose some of the contour that you gained because you're going to get deflated again. So the first thing I check is your weight has been steady for the last at least 3 to 6 months before we proceed with anything cosmetic.
After breast implants, can you still breastfeed?
Yes, usually you can. It should not affect your ability to breastfeed. It also depends where is the implant placed relative to the breast tissue. But overall, it should not hinder your ability to breastfeed.
We are getting several questions about liposuction. Do you do just liposuction, or does it come in with these other procedures, or how does that work?
That's a great question, Peggy. So sometimes liposuction, and this is important, I always highlight that for my patient. Liposuction is not a weight loss procedure. So it's not meant to remove extra weight from a patient, or if they have significant, fat deposition in their stomach or their thighs. That is not the intent of mainly liposuction. Liposuction is meant for etching, for sculpting. And it's meant basically to remove some excess fat here and there, and usually it's used as an adjunct to some of those surgeries. So take, for example, a tummy tuck surgery, right? Tummy tuck surgery will take care of the excess skin and fat in the center part of the stomach. It won't take care of the love handle part or of the flank part. And if patients, might require some extra fat to be removed from those areas, liposuction is a great option for those patients. In rare instances, liposuction could be a standalone procedure, but usually not for the patient population we're just talking about, which are weight loss patients that lost a lot of weight, they have a lot of excess skin. The liposuction will not take care of that. So again, it's tailored to each patient's needs separately. Usually it's an adjunct to the bigger surgeries in the weight loss patient population.
We talked a little bit about this before the presentation, because I was getting so many questions in about the different costs of all these different procedures. But you're saying the best thing to do really is to make an appointment, and you can go over that, because there's so many different procedures, different things that go into the different procedures. People may have different insurances, different histories, there's a lot there. It's just best to see you, right?
Absolutely. So, I always, I get asked this question, so where does insurance play in these stuff? And insurance is meant for, medically indicated procedures, and I think among all the surgeries I just mentioned, sometimes the paniculectomy part of those surgeries, where you have, a medical necessity, whether it's, severe skin rash that's not, remitting by regular creams, and you're needing prescription medication, or you're having a lot of this hanging penises affecting you, causing you a lot of back pain, so on and so forth. This is kind of the subgroup of patients where, it's medically indicated, and insurance usually are okay covering that, while the other procedures are usually considered under cosmetic. And again, there's so much layers and complexity, because there's not one surgery that fits everybody. Each patient is different based on their needs, their aspirations, their body habitus. We all know that we store our excess weight in different parts of our body differently, right? And so each patient is different, and each surgery is different accordingly, hence the finances of that would be different accordingly.
And people, I think, just should know, too, in general, that, there is, a lot of federal regulations. There's so many things going on now about transparency and costs. So, before you have a procedure, all that will be spelled out. You'll know exactly what you're getting into, what the costs are. And,
absolutely, absolutely. We break down, since you brought that up, we break down our fees into hospital fees, anesthesia fees, surgeon's fees, and we really give the patient a handout with actually, that they have, if they decide to move forward, they'll have to sign it, so on and so forth, where all the details were shared with them. So yeah.
Because there's so many different procedures, might be kind of difficult. Maybe you can run through them. I'm not really sure, but there's some questions about recovery. What the recovery looks like. How much time do you have to take off work? When can you exercise again?
So that's all great questions. So ideally, for cosmetic procedures, I try to do my best to all procedures to plan them to be outpatient surgery. So that's the first thing, where we avoid hospital stays if we can. In rare instances, hospital stays are necessity. I try to limit surgeries that are cosmetic down to less than 5 hours, because we know that right around 5-hour mark we start getting a bit more complications. The need for keeping patients in hospital will be higher. So we try to limit them and divide them into smaller chunks of procedures, especially if somebody needed more than one thing to be done at the same time. We try to divide them into kind of 5-hour chunks. Recovery differs obviously from patient to patient. Most patients are okay around the 2-week mark, that where the pain is manageable, everything is okay. Most patients, I release most restrictions around the month out from surgery, as in, going back to exercising, going back to whatever their, usual things that or exercises they do around the month would be okay.
Let's go through some of these that people ask if you do calf augmentations.
I do not do calf augmentations myself. No.
What about skin removal from the chin?
So chin removal or neck lift per se in particular, usually it comes either offered separately as separate surgery for the neck, or it comes as part of a facelift where we tighten the muscles around the neck area and also get rid of some of the excess fat in that area. So we do offer that.
Do all these surgeries, do you need general anesthesia, or could you have an epidural and be awake during the procedure?
So I don't, most of those surgeries, I offer them under general anesthetic. I think it's a safer, more well-controlled surgery in a general anesthetic setting where we have control over the patient's blood pressure and all of that to a bit better degree. That would be kind of my preference, and that's mainly what we offer at Hurley.
Do you have to come in for revisions, or if somebody had something done, could they get a revision if they wanted something more?
So good question. So I think expectations are extremely important anytime we offer a cosmetic surgery. So I do my best to really highlight what is the patient getting into, right? I ask them sometimes to get me some photos of things that they found online that they think, you know, I want to look similar to that, or is that an option for me? I go over all the potential risks and benefits from the surgery. And the reason we do that is, again, expectations, if they're met, there's no perfect answer, right? There's no perfect body image. There's no perfect shape of a stomach, because each person is different. And the goal is to hopefully prepare them to the outcome as much as possible. Every now and then we do meet patients that, you know, whether their expectations were not met or what they thought were their expectations were, even though they were explained to them, maybe it didn't meet what they wanted, or they wanted even, you know, different changes. So for those subgroup, sometimes there are options for revision surgeries. Sometimes I even, you know, if we had a full explanation of all the options and, you know, we met those surgical expectations and they're not happy, sometimes I even refer them to a colleague of mine to have them get another opinion as well before we jump into another surgery.
Does having a C-section affect a tummy tuck?
Usually it doesn't, but every now and then we do see C-section scars that, you know, extend outside the norm of a C-section, whether it was you know, emergency C-section or a complication, or sometimes the C-section scar is placed so low, closer down to, you know, to the clitoris. And again, we have to work with what we have on the table per se, but I do kind of warn the patients about where the C-section scar is starting and what I can offer based on that. So yeah.
This is kind of on that same line, but I got a text that says, if you have problems with thick skin from surgery, people of color, how would this affect you?
So I think it's not really a thick skin. Sometimes we have, if we look at the skin layers, we have the layer that has the fat, and sometimes we call it fibrofatty. So some patients have a higher concentration of the fibrous layer in this fatty layer. That predisposes them to a couple of things. So one, it gives them a skin envelope that is a bit tighter, so it will not drape as uniformly as we would like. But on the other hand, the fact that the skin kind of holds itself and it's not very thin, it's a better quality skin, it gives them slightly nicer contour to things. So it kind of, you win on some premises, you lose on some premises. The main thing I worry in patients with darker skin color is of keloiding, widened scar, stuff like that I also kind of bring up and talk about in my pre-operative visits, see if they have any history of that. That would be my main concern, more so than, you know, if is it more fibrous or more fatty, or the combination of the two.
What are the risks of an arm lift?
So arm lifts come with a list of lists. So I would start of potential complication. I would start always with the scar location and the scar widening and the looks of the scar. It's a place where you can't really hide the scar, especially if we go with the standard surgery. And since the arms are usually always under a tension for the incision itself, very frequently we end up with a widened scar. So instead of having a linear, very fine line, some patients end up with a slightly wider scar because of that. There are nerves around the inner thigh, inner arm that could be injured in the process. Can give you numbness, could give you chronic pain if those nerves are injured. There's always a risk of removing too much or being overzealous in trying to achieve the thinnest arms possible, and I will always shy away from that, because the risks come from developing blood clots, or even because of how tight things are, or even not being able to close the incision. So always being conservative, planning accordingly, and again, gauging the patient's expectations are very important, especially in an arm lift.
I think for the most part we've covered everything. We did have a couple of questions that were very specific about their situations, previous surgeries, mistakes that have been made, and that kind of thing. But I think that it'd probably be best just to have those people reach out to you and make an appointment, because that's pretty personal. And
absolutely, and happy to chat with them and look through their history and see if we can help them.
Okay, thank you so much, everyone, for joining us. If you're going to go the route of body contouring, it's important to choose a surgeon who is well-trained, well-experienced, and well-known. Patients are seeing great results with Dr. Saab and feel fortunate he's now practicing out of this part of the state, making it much more convenient for appointments. Contact his office at 810-262-7030, 7030, or learn more at hurleymc.com. You deserve to be the best you. Have a great day, everyone.
Thank you.